All right, Commissioner Schenk, if you want to get started.
Good afternoon and welcome everybody to the Data Driving Equity event to launch the new 2020 Opportunity Index. My name is Sue Schenk. I represent District 2 and serve as chair of the Washtenaw County Board of Commissioners. Today, we're going to be diving into the 2020 Opportunity Index. I'm very excited to learn all about the index and how to use it. But before we get started, I wanted to recognize a couple of individuals and partners who have helped us to this point. Much of this work has been spearheaded by Teresa Gelati, the director of Washtenaw County Office of Economic Development. So thank you, Teresa, for bringing us all together and moving this forward. Thank you to the University of Michigan Poverty Solutions, who along with OCED have led this work. Julia, Natalie, and Lauren, you have all been great to work with, and we wouldn't be where we are today without you. Next, I want to say thank you to our many data partners who helped us access, interpret, and use the data you will see in the 2020 Opportunity Index. They include Ann Arbor Area Transportation Authority, Washtenaw Area Transportation Study, or WATS, Washtenaw County Clerk's Office, Washtenaw County GIS, with a specific shout out to Chelsea Rosick for all of her great work, Washtenaw County Health Department, Washtenaw County Juvenile Court, Washtenaw County Mental Health, Washtenaw County Public Defender, Washtenaw County Racial Equity Office, Washtenaw County Sheriff's Office, and the Washtenaw Intermediate School District. Now I will pass it over to one of my colleagues on the Board of Commissioners, Commissioner Justin Hodge.
Thank you, Sue. I'm Justin Hodge. I'm the commissioner that represents District 5, which is most of Ypsilanti Township and all of Augusta Township. I'm going to talk briefly about why this tool is so important. Whether you're an elected official, a staff person at a community service organization, or just an individual trying to make Washtenaw County better, having good information is critically important. As most of us know, and as we're going to hear in detail later, where you live and the color of your skin has a huge impact on your access to opportunity. And those opportunities are often what makes it so you can do with your life what you would like to do with it. The Board of Commissioners is committed to using this tool as a means to better understand and begin to address the structural inequities that exist in our county so that everyone has the opportunity to meet their full potential. Earlier this month, the board unanimously adopted a resolution that called on us as a board and all Washtenaw County departments to use the Opportunity Index to make policy and program decisions. We hope that all of you would do the same with your work. Because while we do a lot here at the county, there is so much amazing work being done by nonprofits, neighborhood associations, our local universities, and many others. We want to make sure that you have the tools to do the most good you can. We think this is one of those tools. Back to you, Sue.
Thanks, Justin. I absolutely agree that using data to maximize our impact is extremely important. And I look forward to working with you, our fellow commissioners, and Washtenaw County staff on this. Next, we're going to hear from one of our important community partners. Julia Weinert is the Managing Director of the University of Michigan Poverty Solutions.
Hi, everybody. Thanks, Sue and Justin. I'm really excited to be here and to launch the Opportunity Index with all of you. You know, at the university, we absolutely love to parse data and collect information to give us a better understanding of the world. But we wouldn't be able, you know, it's also so important to us to be involved in projects like this and to have openly accessible tools like the Opportunity Index so that we have outlets to apply what we're learning. So I just want to thank Teresa and her team at OCED for approaching us to be involved in this update from the original Opportunity Index, which launched in 2015. And a big shout out to some former staffers at Poverty Solutions, Kate Naranjo and Shruti Naraharasetti, who really sort of led the charge from our perspective and were involved in the initial conversations and worked closely with community partners and stakeholders to ensure that this update remained relevant. So for folks who are new to the index, basically what the index is it combines data from multiple different sources and it puts it together to generate a score that gives us a better understanding of what access to opportunity is. Oh, thank you. So we've got some slides here. Wonderful. And we worked really hard to curate and identify data points that are both relevant here in Washtenaw County and are also shown by evidence to be predictive of access to opportunity. So you can see on this slide here, by looking at the indicators, how we grouped and defined different categories: health, job access, economic well-being, education and training, community engagement, and stability. And let me just say, there is a lot of data out there. So we had to be really strategic and thoughtful when we were crafting this index to make sure that it both was reflective of access to opportunity and also easy to navigate and act upon. So the goal of all of this, as Justin mentioned, is to help us get a larger view and to help inform policy making and program development and much more. I also want to point out that a big part of what we did when we updated the index was to improve the overall website. So a big shout out again to Natalie Peterson and Lauren Slagler, who are here with us today and who played a big role in that part of the project. The new website includes sections on key highlights, which is similar to what you'll hear here today. There's also a section on maps showing information about each of the different data points that are included. And this is going to be really helpful for folks who are writing grant proposals or who would like to use the maps for presentations. And then there's still the same very robust data that you can dig into for anybody who's interested in getting into it at the nitty-gritty level. So we'll get a bit more into that during training sessions later on. I just also want to extend our appreciation to the county commissioners who adopted the resolution to use the Opportunity Index in local government decision making. I think it's a huge win for all of us and will make us stronger as a community. And it just gives me a really strong sense of hopefulness around the idea that we're prioritizing equity in our community. So while this project and getting to this point took tons of work and is a long time coming, we at Poverty Solutions see it as a launching point. And we are excited to continue engaging. We've already started to find interesting data in the numbers that we can act upon. And we look forward to working with and we welcome opportunities to partner with all of you going forward. So thanks so much.
Thank you, Julia, and thank you to everyone at Poverty Solutions who has been a part or supported this project. Now it's time to start diving into the new Opportunity Index and start learning about what are the key takeaways and how we can start digging deeper. If you have questions, please feel free to submit them in the chat and we will get back to them later in the meeting. To start that conversation, I am going to pass it on to Washtenaw County's Racial Equity Officer, Elise Asbury Payne. Thank you, Elise.
Thank you, Chair Schenk. I'm excited to be here today for the launch of the new iteration of the Opportunity Index. Anyone who's spoken to me for more than a few minutes knows that I am a data and numbers person. And this tool makes where we are as a county in terms of opportunity, privilege, and access easily accessible to the public, to community service organizations, to human resource organizations that can help use this tool to drive data decisions. So very excited to be here and just want to extend a shout out to the entire team at Poverty Solutions, the county team that has been working tremendously hard on getting this tool ready for launch. And I'm especially glad that this new iteration contains a more user-friendly access interface. Next slide. So as a starting point, when we're looking at the Opportunity Index, it is a visual representation of what privilege looks like in our county, where your geography, your race, your ethnicity, your gender, your sexual orientation, your physical and cognitive ability, and your social and socioeconomic class all impact the opportunities that you have access to, and in turn, what those can mean for the outcomes in your life. What we are talking about with the Opportunity Index is structural impact. So more often than not, people will have a sense that their individual choices make up the options and opportunities that they have access to. And that's not accurate. What we know and what this data gives us access to in a way that's easily accessible to the public is that your opportunities, the level of privilege and access that you have in your life are systemic. Race matters. In Washtenaw County, race and place determine your access to opportunity and frequently your level of privilege. So 8 of the county's 11 census tracts with the lowest access to opportunity, the lowest levels of privilege, are primarily areas of people of color. All but 1 of the 27 highest opportunity census tracts have a majority of white residents. So those are stark differences. When we think about what that means in terms of access to education, healthcare, your life expectancy even, grocery stores, basic infrastructure services, those are all things that we can see in the data in this mapping system. Once you get outside of the urban core, we can see that I completely lost my train of thought there. But once you get outside of the urban core, you can see that you also start to lose access to basic opportunities. Areas like Northfield, Augusta Township, and Manchester all have low access to opportunities as well. And those are not necessarily driven by race as much as location. I'll turn it back over to Commissioner Schenk.
Thank you, Elise. That was a great overview of the key findings of the index. We're going to keep things rolling and go to Teresa Gelati now to go into a little more detail and give you an idea of how, in addition to the big findings that Elise talked about, there are all sorts of important things you will be able to learn from this tool. Teresa?
Thanks so much. I'm so excited to have this many people on the call, over 90 people, to be talking about this. Let me kind of run through a little bit more about the map, some of those things that Elise highlighted. Peter, if you can pull up that slide. Great. Just generally, the way this is set up is, and Julia was mentioning some of this earlier, is that we're looking at access to opportunity. So the dark blue that you see as it's laid out is the highest access to opportunity in the county, followed by the lighter blue. You get to a lower access with the pink, and then sort of the reddish color is the low access to opportunity. Some of those slides that Elise was lifting up to you, you may have noticed where we look, she mentions race and place, but the race slide where we see more people of color, we're actually, those match up very closely to our lower access to opportunity areas. Likewise, those other ones where we talked about place are the rural areas with impacts. She mentioned Northfield Township, Augusta, Manchester Township, and Sylvan. Those were places where we also have lower access opportunity in the rural areas. So you see a lot of the lower access on the east side, outside of almost the 4 corners of the county. And then where we have that high access to opportunity and access to privileges in and around Ann Arbor, but then also a lot of those township areas. With a few exceptions, of course, you see the split there with Chelsea, with half being very high access to opportunity and then a lower on the other side. So that's how we're representing it. It's based on census tracts. It's as small as we can go that the data quality would be good, but it does let us see the whole county and look at it all together to sort of get an overall sense on how we're doing. So Julie had mentioned that we're using a lot of different data points to bring this index together. So I'm going to focus on a few of those categories. This is the overall map, but if we want to look at individual sections, and this is on the website too, there's a separate map for those. So in the areas of health, and this measures 3 different indicators, it's a slightly different map. We're still seeing lower access to opportunity on the east side, but you also see a few spots in Ann Arbor, parts of Chelsea, Saline, and Northfield Township, as well as Augusta Township. And some of those high access to opportunity areas or high performance around health are in different locations, including Manchester Township and Village. And later on, we're going to dig into that a little bit more in the training so you can see, you'll be able to look exactly into any census tract and find out exactly what's going on. The next slide, we'll be looking at factors related to job access. And you see that, again, the map totally changes, which is because we're looking at, again, different elements of it. Job access includes transportation. So if you think about transportation cost and access to jobs where our job centers are in and around Ann Arbor in the urbanized area, obviously the rural areas would have increased costs because you're traveling somewhere most likely for your employment. There's other factors that are playing into that, but you can see again, that's the shift that we have for each of these sets. And the next one, we're looking at economic well-being. In this section, we're looking at things like child poverty rates, home ownership in areas where there are single family homes or duplexes, and also access to financial institutions. Do you actually get to have a bank near you that you can utilize, or are you limited to check cashing locations or other features? Again, you see a shift a little bit, especially outside of Ann Arbor, a little bit in Scioto Township, a little bit in Pittsfield Township for lower opportunity areas, but the east side is again showing up with less access around economic well-being. When we look at education and training, it really sort of shifts. Again, east side is showing a little bit lower, but again, shifts again, Manchester Township, portions of Chelsea, adjacent areas too. And education, we're looking at things like preschool enrollment, 3rd grade reading tests, and a 6th grade graduation rate, which we're really excited to add into the index this year. This idea that if you look at a dropout rate, you never capture those folks that are able to come back to school in some capacity and finish their degree. So that's a new feature, one of our new data points that we're really excited to have included that you'll be able to have access to when you look at the index. Let's go to the next one. Community engagement and stability. Here we're looking at such things as juvenile criminal charges. This is a new feature again this year. Vacancy status of residential units, and also participation rates for voters. Again, you're seeing a shift, and I'm actually going to show you the voter participation rates in a minute. So let's move into some individual indicators where, just so you can understand the depth of information that you could be pulling out of the Opportunity Index. So I mentioned like each of the sections, you can dig into each individual indicator. You can actually make your own maps out of the index. It's that flexible. Here I lifted up early childhood enrollment. Locally, the Washtenaw Intermediate School District has helped us understand that ideally we should have 75% of all 3- and 4-year-olds enrolled in early childhood education. Here, only 22 out of 100 census tracts meet that goal. And when you look at it, that's a county-wide need. So this isn't unbalanced like we were looking at before, where we saw the east side showing up with lower opportunity. We're seeing that as more of a broad need outside of the northwest side of the county. The dark blue in this case are where there are census tracts that have 75% of 3- and 4-year-olds that are enrolled. And then as you get to lighter colors, those are lower and lower quartiles in this case. But these are the kinds of information that you can look up and use it as far as decision-making and planning efforts. For voter participation, this is related to voter turnout. So in a normal November election, we look to have about 60% of eligible voters voting. And you can see, again, the dark blue is folks that met that standard, that a lot of those census tracts are performing well, but more than a quarter of Washtenaw County was below that threshold. And where do they show up? They show up in areas where you have a large number of students, lower income folks living, and also communities of color. So that might help when you think about outreach efforts. And we know that several of the clerk's offices, Ypsilanti, City of Ann Arbor, and Washtenaw County had special efforts to help with voting on campuses, and there will be additional needs for targeting those in the future. Severe housing cost burden, and definitely couldn't be talking to you all today without talking about housing. This data pretty much reflects a lot that was in our 2015 housing affordability and economic equity analysis. But what severe housing cost burden is when you're spending more than 50% of your household income on housing costs. And where you're seeing those darker colors, that's where that's happening. The two highest census tracts were in downtown Ann Arbor. So students, again, who are going to show up as not having much income and probably some significant housing costs, and also the south side of Ypsilanti. Those were the two that were the highest. So we're seeing this very high expenditure cost. It's related to both increasing housing costs and having incomes remain flat over the last few years, even before the pandemic was a factor. And on this last side of the deep dive, if you will, is a life expectancy map. So we talked a little bit about the differences related to race, but in life expectancy, we range broadly here in Washtenaw County. It goes from 70 years to 89 years old, depending on where you're born, what you're likely to live, how long you're likely to live. The weighted national average is about 71 or 78 years old, excuse me, but 21 census tracts are below the national average. And I just want to say there's not enough data, so that north side of Ann Arbor is actually where there's no data available. So where you're seeing those lower life expectancies is in Northfield Township, in Ypsilanti Township. It's actually a little bit lower in parts of Saline and in Augusta Township, as well as portions of the city of Ypsilanti. But I will call out that the lowest 5 census tracts for life expectancy are in Ypsilanti Township. And the highest 5, there's 2 more in Ypsilanti Township. They're in the highest 5, as well as Superior Township, the west side of Ann Arbor, and Webster Township. So there is some variation there. But obviously that's an area where we want to try and look into those health factors, those health indicators, and see if we can be addressing those issues. Let's go into the next slide. Which, speaking of health, I'm going to hand it back to Sue, who will bring it over to Laura.
Thank you so much, Teresa. For our final presentation, before we learn a little more about how to actually use the index, we are going to hear from Laura Bauman, who is an epidemiologist at the health department. Because while the data that went into the index was collected before COVID-19, we know that it has only shined a light on an exacerbation that we heard Elise and Teresa talk about in the index. So Laura, I turn it over to you.
Thank you so much. It's so exciting to be part of this launch and to know, as Teresa and Elise talked about, that there's just, let's see, can you hear me now? Okay, great. Again, thank you so much. And yes, as Teresa said, the COVID-19 pandemic has just shone a light on longstanding inequities that we know have existed in our community, and has just been an incredible year for all of us, and for those who have lost loved ones. Again, what a year we've just been through. So Teresa asked me first of all, we shared some of the COVID-19 data with the Opportunity Index, but also to kind of just go over some of how that, as this has swept through our community, again, how that has brought to light some of these longstanding issues that we're all working on and care about. Next slide, please. So yeah, March 2020 seems so long ago, again, on this journey that we've all been through together. And I just, want to say a little bit about kind of, where we were and where we are, and we're 14 months into this pandemic. And that at this point, we have over 25,000 confirmed and probable cases in Washtenaw County and 269 deaths. Although unfortunately, since I made this slide, I've learned of a couple more. And I just, again, my heart goes out to all families and neighbors who have lost a loved one in this pandemic. So just again, to, talk about kind of where we were and where we are now. Our early cases of COVID were mostly connected to international travel from Europe, but quickly this changed to community spread. And our first case was detected in Washtenaw County on March 12th of 2020. Our first hospitalization followed soon after, and our first death on March 22nd, 2020. So I decided just again, as my coworkers know, I live 24/7 in the COVID data. I'm in charge of the EPI team that's doing data. I work 7 days a week on data, but, trying to, kind of talk again about where we are and to start making some sense of this. But I know we'll be looking at this pandemic for years to come and trying to understand what happened. And so what I'm going to talk about today in this very brief comments is a very high level, very first look at where we are. So I think the hospitalization data clearly in Washtenaw County clearly shows the 3 waves that we are in. Currently, we are in wave 3 over here that kind of started in mid-March, and we are in the midst of it. And again, for those who come to our COVID data page, just to, again, a quick orientation, this is hospitalizations per week. The orange at the top are our over 80-year-olds, and down to our youngest 0 to 17. Fortunately, we've not had that many kids hospitalized with COVID, but every other age group is well represented in these 3 waves of COVID hospitalizations. Next. So let's just talk about the first wave. And again, that, I'm just kind of defining as that, mid-March until the end of May 2020, we were at stay at home. There was a statewide stay at home order. Most schools were shut down, but essential workers still had to go in. Our grocery stores were still open. We still needed to keep things going, and they were still getting exposed. We had a high hospitalization and death rate. And this was when, fairly soon into the pandemic, we saw there was this disproportionate burden of hospitalizations and death in our Black and African-American residents in Washtenaw County. And this was seen also certainly across Michigan and the United States. And so what we saw in the spring is overall, about 12 to 13% of our Washtenaw County residents are Black, but 41% of our hospitalizations in the spring were in our Black residents in Washtenaw County. And again, this it underlined both the higher rate of exposure that was occurring in our communities of color, but also, again, the longstanding, some of the understanding. And again, there's still so much we need to understand, but we've been learning that if you have hypertension, diabetes, cardiovascular disease, which we know have just been longstanding health inequities, that also makes you more vulnerable to the severe effects of COVID. And in the spring, that first spring, we also learned of the devastating impact that COVID was having in our long-term care facilities, our very vulnerable residents. We had numerous outbreaks in also our correctional facilities. Next. And fairly quickly, we started here at Washtenaw County Health Department publishing zip code maps. That was kind of the level at which we could quickly put data out. We wanted to focus, where our testing efforts were happening, resources. We had people bringing out boxes of food to people who were in quarantine and isolation. And more recently, we're using our mapping capabilities to focus vaccines. But again, we know we know place matters. And again, as we're talking about the opportunity index today, that it's so important to understand where the need is. And then in the late summer, early fall, kind of in between wave 1 and 2, our epidemiology team had a bit of time to get the data clean enough that we could put it into the census tract at the census tract level. And that's what I shared with Teresa to kind of, as we were looking at the opportunity index and how that intersected with the first wave of COVID, that we really wanted to include that. So we'll look at that next. So again, this is really the first 6 or so months of data from the pandemic, and you can see that those circles are where we have higher rates of COVID, and in general where they really align with the areas of the county with lower opportunity. We particularly saw, you can see on that east side of the county and in the Ypsilanti area, that in the first wave that we had really a lot of COVID that was detected, and again, the experience of our communities there. Next. So in the second wave, this again, I'm kind of just defining as beginning of November through the end of January. We were seeing a lot of cases in our college students, big outbreaks, of course, University of Michigan on EMU, our young adults, lots of gatherings, and it, but then it translated into, again, a high hospitalization and death rate in our older residents, again, as that spilled out across the community, and we had greater burden of COVID spread. And we did see, though, in that second wave, that our hospitalization rate in our Black community, our communities of color, actually decreased compared to spring. It was still too high, but it went from over 40% of our hospitalizations down to just 21%. Again, it's still disproportionately high, but it was good to see that start to come down. And again, in the second wave, we continued to see numerous outbreaks in our long-term care facilities and group homes. It's where a lot of our hospitalizations and deaths were coming from, unfortunately. Next. And again, just to kind of reorient, we are in the third wave. We are in the middle of it right now. It does look like, I'm happy to report, it looks like we are coming down out of that third wave. Our case rates are coming down. Still, hospitalizations are being reported, but I'm hopeful that we are coming through this third wave together. And one thing I just want to note on this slide, if you notice the difference in the as you look at the orange color on the tips of the graph, that those are much shorter. Those are our 80-year-olds. We have very few 80-year-olds now getting hospitalized, and that is because of vaccination. And next slide. So in this third wave, this is where we're dealing with these more contagious COVID variants. And so that has, again, changed the dynamic yet again of this pandemic. We've had a high demand for vaccine, and the supply has been limited until recently for individuals under 65. But I'm happy to say that we now have a lot of vaccine available, and we are asking everyone who's 16 and older to please go get vaccinated and to sign up for an appointment or even walk in. There's lots of opportunity now. We've had very few outbreaks in our nursing home this time around, again, because of high vaccine rates, but the hospitalizations continue, and they are in somewhat of a younger age, but it's still our individuals who are 50 years and older. That's where 70% of our hospitalizations are in individuals 50 and older. And unfortunately, the rate of the proportion of hospitalizations in our Black community is is now about 32% in this last wave. So again, we just, this pandemic has just laid bare these longstanding inequities. And even though no vaccine is 100%, the COVID vaccines are excellent vaccines, and they have been very effective at keeping people out of the hospital. And so again, this is my plea to all of you. If you go to the next slide, we are making tremendous strides in Washtenaw County to get vaccinated. You can see over 80% of our 65 and older have had at least one dose of vaccine. That is incredible. And we are at 57% for the entire county. And if anyone heard the governor and her staff speak this morning, we're already meeting some of the metrics where they're going to start rolling back some of the different restrictions across the state, but we have to get everyone there. And we have, as Teresa and others have been sharing about the Opportunity Index, we have across our county, we have a lot of differences by census tract of where people are with vaccine. And we're going to be sharing that census tract vaccine map fairly shortly here at the health department. We just got the okay today to start sharing that. So that'll be coming out in the coming week, that we will be sharing on a regular basis where we are in Washtenaw County by census tract in COVID vaccine. So please, everyone, go get vaccinated. We know we are all in this together. Thank you.
So thank you, Laura, very much for that very detailed presentation. And I also, before we move on, I want to take a moment again to acknowledge the deep loss of the 270 or so people who we've lost to COVID-19 during the past year and a half. It's a loss greater than, it's just a huge loss. I would also like to acknowledge and thank some public officials who are attending today. We have with us today Washtenaw County Commissioners Caroline Sanders, Shannon Beeman, and Ricky Jefferson, Washtenaw County Prosecutor Ellie Savitt, Ann Arbor City Council members Lynn Song and Kathy Griswold. Thanks for being with us. So thank you so much to all of our presenters to this point. Before we jump into the index, let's take a minute to answer any questions you might have so far. People have been submitting questions, so we will start with those. But if you have any other questions, please raise your hand and we can call on you.
So it does look like there has been one question asked so far. And it was, are the underlying charts updated as new information become available? For example, voter participation after each election, pre-K enrollment annually. I think I can pass that one over to Teresa. And then after that, if you have questions, either put them in the chat or just raise your hand and unmute yourself.
Yeah, thanks for that question. So we are hoping to update the COVID data. Laura has been so kind, even though they're incredibly busy, obviously, with the vaccinations over in the health department, to commit to helping us update that over the course of the year. However, we probably won't be doing a full update for a year or two. We want to make sure that we're using the new census data. So it won't be updated as we go. We try to do it as a whole review and then an update. So the last one was 5 years ago, as we mentioned earlier. We're going to try and do it at a shorter interval, but the individual data will not be updated to that level of frequency.
If I can jump in real quick, I just wanted to add that as part of the resolution that we passed, we committed to regularly updating it. So it's not going to be the 5 years again. So people can expect more regular updates, but not as frequently as I think this question was asking for. Just not possible, or probably not feasible.
So it looks like there was another question that was asked, which is, where is the data on residency for vaccine stored and how is that different from where the dose is administered? And that sounds like a question for Laura.
Let's see, where is the data for residency? So yes, so thanks, Ryan. So that's the way that the way that we report out vaccine data is again by where you live. So for instance, if you're a Washtenaw County resident and you went to Kent County to get your vaccine, that'll still count as a Washtenaw County resident who got vaccinated. That works well for everyone who got their vaccine in Michigan. We're working right now on all those folks who went down to Ohio to get vaccinated, getting that data pulled back to Michigan so we can count all those doses. Thanks. And it all comes out of the MCIR, the Michigan Care Improvement Registry.
Thanks, Laura. Are there any other questions? Feel free to unmute yourself and ask. Oh, it looks like we do have one from Marcia. So you can go ahead and unmute yourself and ask your question. Looks like you're still muted.
Hi, everyone. This has been a great presentation. In the spirit of race and equity, I want to acknowledge that Ypsilanti Mayor Lois Allison Richardson has been participating in this also. I'm an activist and I'm also an academic, and I'm very much pleased with this data. Much of it is data that we already know is true, and we've known it for a long time, and nothing's been done. And I appreciate that we now have numbers we can insert into grant proposals to ask for funding so that we can act upon this data. But I just have some questions about talk, when do we eat kind of framework. There was a comment about voting, and yes, voting's been a problem among students and low-income people of color, and voter registration officials were responding to students during the election and will be continuing to do so. But no comment further about, well, what's going to happen with the low-income people of color and their voting opportunities. And I'm very concerned that this is going to become a professional exercise in academic number crunching if we don't really make a serious commitment to delivering programs in communities where these numbers must change now. And I think it begins with integrating more our workforces, because my own personal experience is that there is a white fear of low-income neighborhoods and people participating, doing the outreach that's necessary to bring people the basic necessities they have. I've witnessed personally firsthand the boxes of food that were delivered. That was no great thing. You wouldn't want to eat that food. It was delivered to disabled communities as well. Chittister Place apartment, which is historically neglected by the county. So I really want to affirm the fact that this is a marvelous tool. And I already cited it when it was in rough draft, when the 2015 data, just recently in a letter to Congressman Dingell to try to get some congressional appropriation money to help the African-American community improve police relations in Ypsilanti. It's a wonderful tool. I don't want to put that down or negate it at all. I want to applaud everybody who contributed to it. I want to thank you. It has empowered us and elevated our capacity to do something, but we absolutely must understand this was just the first step. It was the opening round. And what we really need is the leadership of the county officials here today, the elected officials today, the incredible array of leadership skills on this screen. You're all such impressive people. Please make a commitment to the next step in the conversation, in really critical examination of why are these numbers what they are and what must be done relentlessly until these numbers have reached some level of equal opportunity index. Thank you.
Thank you. Are there any more questions?
it looks like there's one more question in the chat that was asking about do we have vaccine data on those who went to Taylor or Wayne County? That will also be included in the upcoming maps. And again, I'm looking at Laura for the answer to this one.
Sure. Yes, absolutely. Again, if you or family or neighbors went anywhere in Michigan to get vaccinated, you will show up as counting for Washtenaw County because we use a statewide vaccine registry. Thank you.
Thank you.
I want to jump in real quick because to respond to the previous comment, because I mean, I want there to be some sort of response to it, and just to say that one of the reasons why we passed the resolution and made it as specific as we could is I see this as a first step in us making more data-driven decisions. So there's more of that to come. There's clearly an interest on our board in doing that. And I would hope that we would continue to have the kind of community engagement that we're having at this meeting as we start to make decisions using the Opportunity Index to target a lot of the issues that were brought up. So I hope people will continue to come to our meetings and hold us accountable for doing that. Because we're going to continue to do this, we're going to continue to use the Opportunity Index, but hearing that there's such passion in the community for us to do that, I think that encourages us to really even look at it more seriously. So yeah, please continue to engage with us about it.
Thank you. So Peter, are there any more questions or is it time to move on?
It does look like there's one more hand raised from Debbie Swanson. So if you want to unmute yourself and ask your question, that'd be great.
Yes, I'm concerned about, or I'd like to know more about how the vaccination information is going to be put in. Will you have the ability to put it in by the date that people received it? Because the number, when you showed 41%, and then there was a decrease, and then it was back up to 32%, my thinking is that that possibly has to do with vaccination access. And so are we going to be able to look in the census tracts and see who was vaccinated almost in time? Like who were the early people vaccinated? And as far as a census tract, are you going to be able to put the data in a way where we'll be able to look at that?
Thanks, Debbie. We recognize that, for the first, 3 months or so of vaccine rollout, that supply was really limited and people who wanted vaccine had to wait, unfortunately. And so that, people over 65 and certainly healthcare workers and some of the other first line folks were able to get access to vaccine. But the data that we have available to us is cumulative real time. So once we start putting it out, we'll probably, my guess is we'll do it as a snapshot, but it won't, we don't have a way to go back and say, as of, March 1st, who was vaccinated. It'll be, as of May 1st, who's vaccinated, and then we'll do one again in another week and say, how are we doing in some of the places where we know there's, we've had lower vaccine rates, and we've done outreach, and we've talked to people and answered questions and really worked on, again, trying to get good vaccine access, pop-up clinics. Have we made a difference in those communities? So that is our intention.
Thank you. So thank you for all your questions. Before we move on, I am going to go back and I missed a few of the elected officials who are attending today. And so I want to recognize Commissioner Katie Scott of Washtenaw County, Mayor Lois Richardson, and our Administrator Greg Dill, who is not elected, but is very important to the work of this organization. So thanks again for all of your questions. We will have more time later for additional questions, but right now, I'm very excited to learn more about how to use the index. So I'm going to pass over MC duties to Teresa, who will get us split into breakout sessions, and then will bring us back together to learn about how key partners used the index last time to make important decisions. And I just want everybody to know that all the commissioners are really excited to be able to have this tool to use. Teresa?
Thanks, Commissioner Schenk. We're excited for the second half of this session. We're going to actually do a mini training. We're going to break you all into 2 groups. So Natalie from U of M Poverty Solutions will be taking a group, as will I. And so we're going to make sure that you have some comfort with using the tool, and it's going to be sort of a mini training. For those of you who want to open up the tool, we encourage you to actually click along while we're talking and showing it to you so you get a little bit of practice, and there'll be other opportunities for trainings as well. But after we look at things a little bit, what we're going to do is come back as a big group. And I hope you stick around for this because this is the real meat of things where we talk about how do you use the index? Like, what do you do with it? Some of the questions that Marty Bombick brought up, like that's great to know it, but now what do you do? So how can it be used in decision-making? How can it be used for investments? How can it be used for changes in programming or policy? So we'll be talking about that and using some specific examples from the actually what was done in the last index. Some folks who are thinking about how to use the current one, and folks that have already been applying both the old and the new index. So we hope you hang around for that as well. So I think we're about to break out into those breakout groups. I'll see some of you in a few and then meet you all back here in about 20 to 30 minutes. Kicked back into our full group, but it's still great to see you all. All right. Also, we have 74 people still. That is phenomenal. Thank you all for sticking around. I will tell you that I'm open. Anybody who has any outstanding questions after this, please reach out to me. Also, I think there's some questions about how do we select the data we did. Happy to talk more about that. And also happy to do some trainings. One of the things we did with the first index is set up times and did a lot more trainings with folks. I know a lot of nonprofits have been using it regularly for grant applications. We'd love to do that again. So open to all of that. But I don't want to take time from this session because it's awesome. It's what are we going to do with it? You know, right? We have this information. It's come up a couple of times. What are we going to do with the index? How can we apply it to make some changes so that the next time we do this map, it turns out a lot differently, hopefully for the better. So some lovely people have agreed to talk about this one, maybe with a little bit of, I don't know, I didn't have to connive too much, but I'm so grateful to have Margie Long here from Success by Six Great Start Collaborative, Alex West from Ann Arbor Spark, and Emily Lake from Washtenaw Area Transportation Study. And what I wanted to do is talk about different ways this data has been used or is intended to be used, because sometimes it helps to sort of think about how you can apply it. So Margie, you are first up. Do you want to tell us a little bit about you and the program you work with and how you use the 2015 index in your programmatic work?
Sure. Thanks so much, Teresa. Actually, she didn't have to twist my arm or connive. I was very happy to talk about using the index because it's helped a lot with our work. So as Teresa said, I'm Margie Long from Success by Six Great Start Collaborative. We're an initiative that works out of the Washtenaw Intermediate School District. Our vision is that every child will enter school healthy and with the skills they need to be successful. So we focus mostly on the early childhood system and trying to do systems change as opposed to doing direct service. But we do work directly with parents to try to empower them to have some change to ensure that programs are meeting the needs of their families. About 3 years ago, we received a grant from the state to focus on what we call our trusted parent advisors. We recruited and trained about a dozen parents from low resource neighborhoods to outreach to their neighbors who have young children to involve them in early childhood education programs and also help them get community resources. And so they were actually going to go, the reason we were doing that was because there's a direct correlation between children who attend early childhood programs and who are successful reading proficiently in the 3rd grade and who enter school really ready to be successful. So we wanted to outreach to those families directly, not expect them to come to us, but to go to where they are. So our trusted parent advisors basically went door to door and looking for families who had children under the age of 6 and talking to them about what programs were available that they would likely be eligible for, and also connecting them with food and utility help and any of the kinds of things that low-income families often additionally need. So to do that, I thought, wow, this could be really intensive if we were going door to door in every neighborhood. But I had remembered being part of a training in the Opportunity Index and had used it a little bit myself, although it's always helpful to have that refresher training. Thank you, Teresa. And what I said was, we can look to see where are there families with a high number of families who are low income, but who also there's a high number of children under 5. And we mapped that together on the Opportunity Index, and those are the neighborhoods we hit first, so that our trusted parent advisors were really being most efficient with their time. Our program with the trusted parent advisors has changed dramatically and scope has changed, but we have always gone back to the Opportunity Index to help us target where we want to go. Is that good enough?
No, that's
Teresa,
great,
did you
Margie.
want more?
I appreciate it. I love that example because it's so specific, and I like that it's been a way that you've been able to deploy your team. So I know it's been wonderful, and they've been actually great partners. So thank you for that example. The next one I'm going to be handing over to Alex West here. So Alex works at Ann Arbor Spark, and I think is more looking at how to apply the index. So this isn't done work, but just thinking about how to use it related to their work. So Alex, can I hand it off to you?
Sure. Thanks, Teresa. First, I want to really recognize the gargantuan task that you have accomplished here. As a data person, I am very excited about all of this, but I am also cognizant of how much went into it. So I just really want to recognize the wonderful task that you've completed and how much it really shows the potential of this data. So in my role at Spark, our mission is to very simply grow the GDP of Washtenaw and Livingston counties. So to that end, I use data to tell a compelling story about the Ann Arbor region for a wide range of stakeholders. This can be anybody from a small startup from Germany considering an office here to a federal government official who's evaluating a grant proposal. It's a really diverse group of people, but it's also very interesting because everybody has their own, say, baseline of how they're viewing the data and where they're coming from. So one way I use maps all the time. So I'm using maps to show, let's see, low-hanging fruit is how many project successes we've had in 5 years across the county. How many companies have we worked with? How many jobs have they created? All that kind of stuff. And then for a little bit more, oh, that's great. So we have a screenshot of this. So this is a way I use a map. And one way we could potentially use the Opportunity Index is to layer the overall score underneath this. And this is more to ask our board and our strategic planning partners, are we focusing in the right areas? Can we be, we have a strategic focus on Eastern Washtenaw County, and the Opportunity Index helps us back that up. We should do more, and this is why. The other parts of mapping that can be very useful with the Opportunity Index is when we're actually talking with a company to consider Washtenaw County over somewhere else. Many companies are looking at location decisions as a broad strategic decision and considering multiple locations at once. So how can we make Washtenaw County stand out? And this is where we can tell stories with maps. A good example of this is KLA, and this is a company that came recently to Ann Arbor, and I used an open source map tool to map all of their questions. These companies, they ask so many interesting questions when they come here. And the Opportunity Index would have helped me so much. So I'm thinking about this in the future as how I could use this data to really tell a compelling story about our region and to also, make it known that we care about equity in our county and we're focused on ways of improving it.
Thank you so much, Alex. I'm excited to see it, and it's interesting to think about. I think when I think about you guys' investments and how they show up, it's tricky because so much of the development's in around Ann Arbor, but then you do see stuff in the out county and the east side. And so just thinking about maybe that could be expanded and how we could be in some of the lower opportunity areas too. So super awesome you guys are willing to do that. So thank you for being part of this. And for the wonkiest of the wonky, a Washtenaw Area Transportation Study has been using the index hardcore. And I'm so glad that Emily's here to kind of talk through how you all think about this related to transportation investments. And I might need to do a little, I know you're planning on this, Emily, talk about Watts and the work you do. But thanks for being here, and let me hand it off to you.
Thank you, and thanks for having me. I'm excited to be a part of the relaunch of this awesome tool. We really applaud your efforts, and we really rely on this data to help inform policy decisions with transportation. And so I'm excited to tell you a little bit more about that today. So as Teresa said, I'm Emily Lake. I'm an associate transportation planner for the Washtenaw Area Transportation Study, or WATS, and we provide planning services and programming of federal funds for local agencies throughout the county. So we have a policy and a technical committee that work to set local transportation policies through the lens of our long-range plan. And they prioritize funds using a 4-year listing of projects called the Transportation Improvement Program. You'll hear me refer to it as the TIP. So every year, the elected officials and transportation professionals on our committees prioritize millions of dollars of projects that enhance not only driving for motor vehicles, but also walking, biking, and transit around the county. And our committee members are very focused on equity and investing in communities that have traditionally been underserved by transportation policies. If you could go to the next slide. Our 2045 long-range plan includes equity as one of 7 goals and states that it should be a determining factor in selecting projects. Also states a goal of increasing the percent of funding that goes into what we call equity areas. So how does this play out in practice? One way is to give equity areas a higher score or a higher priority on applications for projects that are submitted to our TIP. Another way we work towards our goal of equity is we determine a baseline level of investment at the beginning of the TIP that's going into these equity areas, and then we track those investments over time to ensure that they're increasing. So these data-driven processes are a really good start, but in practice, it's not as straightforward as it might sound. The idea is that if all else were equal with projects, the projects in equity areas would be prioritized, would be given preference, but there are a lot of things that can complicate that: size, scope, timing of a project, defining who really benefits from a project. For example, if you have a highway improvement that runs through an equity area, some people might say that that's a positive improvement. Some people might think that that's a negative change. Or if you have an improvement on a corridor that provides connections to what we're calling equity areas and job centers, we want to make sure that we can also prioritize those projects. So these are all questions that we're working through as staff and our committee members as an agency. We just hope to do our best to move the needle in the right direction. And we really rely on the data in the county's Opportunity Index to help inform those decisions. Next slide, please. So we have 2 different methods for identifying what we refer to as equity areas. We use the federal environmental justice areas, which focus on areas with high percentages of low income and minority populations. And this is a requirement for our agency, but we wanted to take that a step further and add an evaluation of the Opportunity Index. We've been using the old version of the index and focusing on areas with an overall score of low or very low access to opportunity. And we added this Opportunity Index evaluation because the additional indicators included in this tool really helped us better understand the needs of our communities, with job, access, health. All of those indicators were really important to getting at a better understanding of the needs, and taking advantage of a tool like this has really helped drive more investment to the county. So using those identified equity areas and the tip listing of projects, we run an analysis to calculate the portion of all project costs that fall within equity areas. Next slide, please. So we provide this analysis to our committee members 3 times a year with each tip amendment period, which is for major costs and scope changes of projects, and these go to our committees for approval. And unless there's a special request from a committee member or the public, this is the only big piece of analysis that we provide on the tip at each amendment. So I think that that really underscores how important it is to our committees that we continue to increase funds in these areas. And the numbers you see here on this slide are the opportunity index evaluation that we provided during the last tip amendment. So this was done using the old index, and at that time we had about 96 million being invested in low and very low opportunity areas, and that represented about 17% of the total tip value. You'll notice we also have a line for transit there that we present. We include these investments in the evaluation because we still struggle to measure investments that are area-wide in nature, so not tied to a specific geography, but may in fact benefit an equity area by improving access and mobility. Next slide, please. These charts show how those investments in low and very low access to opportunity areas track over time. And you can see here that over the course of the current tip, investment has approximately doubled from 51 to 96 million, and as a percent of the total tip value has increased from 13% to 17%. So by tracking these investments, our committees have an opportunity to formally evaluate if enough funding is going into these areas and make sure that the funding continues to increase. And again, this is just one of the processes that we use to help work towards our equity goal. It's not a perfect process, and it's still challenging to measure how these investments are impacting the outcomes that the county's opportunity index has measured. How are these investments really affecting those outcomes that we've learned about from the opportunity index? But this is something that we're working with our committees and stakeholders to better understand. If you go to the next slide. This is an overview of how those numbers that I just shared would compare to the new opportunity index. As you can see, the area coverage that we'll be focusing on, those areas with low and very low access to opportunity, that area coverage has decreased significantly. And we do believe that it is accurately representing the areas that we want to target. But it's too soon to really know how that change will impact policy. We'll be providing our committees with another equity evaluation during the summer tip amendment. And at that time, we'll be using the new index for our analysis. The new index also comes at a very timely manner because we will be starting the development of our next tip very soon, and we'll be including the opportunity index in some capacity in our application for projects. So if a project does fall within one of these areas, it will likely have a higher probability of securing funding. And I'll just say again that our committees are very focused on equity. It comes up very often in our meetings. If new funding is identified, often people will speak up and say, let's spend that in equity areas. So we really do rely on this tool and are excited about this update. Thank you.
Thanks, Emily. That's such a great example and really a testament to the work y'all are doing at Watts, creating the equity seat, really getting the policy in place, and then using it actually for your investments and for programming. So I so appreciate that you kind of did the whole scope of it, right? So the policy provided by putting the seat and the voice there, so that could be part of those decision-making process, and then actually changing how you invest. So It's really a great example. So glad you could be with us today and lay that out for us. That's fantastic. So we have a little bit of time left, and I'd love to see if there are any outstanding questions that we can help with. I guess that's it. Let's see what kind of questions are still out there. If there's any for, I should say first, if there's any for Margie or for Alex or for Emily, let's start with those three. No questions
It
for
looks like
those three?
one hand. It looks
Oh,
like
there we go.
Kevin has raised their hand. So if you want to unmute and ask your question, that'd be great.
Sure, I have a question, but it wasn't actually for the last group of people, even though they were
That's okay.
awesome presentations. I had a question, again, echoing all the comments about how much work has gone into this and how great a resource it is. I was wondering if there are any plans to include data from the prosecutor's office or the Washtenaw County Sheriff's Office in this database at all.
Yeah, so we were really careful in how we included them. We actually had representatives from the courts and the sheriff that were part of our data committee. We had a nice representation from them, also folks from the WISD I'd mentioned, the health department, Ann Arbor Area Transportation Authority, Watts, and others, so that we've had a large group as we brought together the indicators and refined them for this second round. We'd be interested in taking a look at it. I put in the comments and responding to someone else, but one of the things that we have to look at when we're adding an indicator or thinking about it is what is it really measuring? So in the chat, someone had said, oh, can we see SSI or the community mental health folks that are served, where both of those are income eligible programs. So if we were to layer that data on, we'd actually be probably measuring poverty again, and we already have that in the index. And so that's one of the things that we try to make sure that because it's an index and we're bringing this large array of information together, that we're not measuring the same thing multiple times and or allowing that that there can be fluctuation based on what we're including in there. So we would for sure consider it, but we'd have to give a lot of thought to what's the right thing. I think there's some other pieces we can do. We mentioned layering on, and I think it's important because we want to see, it would be great to look at all the cases. We could look at we can look at drug cases and map them on the index and look at it around how its opportunity areas are based on race or things like that. There's a lot of things that we can layer on top of it and sort of have a sense on how that's playing out. If there's something going on in a particular geography, I think that's very valuable. So I guess the answer to your question is we would absolutely consider it. They were part of our initial conversation, but we'd have to figure out how it would fit and make sure that we weren't sort of double counting or measuring the same thing twice. Yes, Katie.
I feel like I'm cheating because I already got to ask you questions at a county commission meeting, but just let me say, thank you again for the work. It's really incredible. And I feel like I can see where it's going to help us at the county to like even thinking about what our goals are as commissioners in the county and then being able to track as change. So what I'm wondering is when there's more data that comes in and hopefully things change for the better, if we'll be able to access sort of an older version of this opportunity index and a newer version so we can track those changes and see what change looks like over time. Thanks.
That's a great question. We tried that with the initial index and it didn't work very well, but we can definitely want to try again. I think it would be interesting to see if we could, and I don't know if it would be on a map or maybe it would be charts or how we could measure it, but it would be interesting to see like where we were in 5 years and where we are in the next 5 and sort of how that played out. I don't quite know how we do that. Perhaps Poverty Solutions might want to partner with us again to figure it out, but I think that's definitely something we're interested in pursuing with the next iteration.
Yeah, thanks, Teresa. I think it would be really helpful just in terms of the way we look at spending and what we're doing just to track that the programs that we're undertaking in the county really are helpful. I believe they are, but it's always nice to have hard data behind us. Thanks.
Yeah, and I think one of the things, just to note that, like one of the things I think the index is really doing is showing sort of the condition in the county as a whole by geography. So it doesn't quite get into like the program evaluation pieces I think sometimes we really want to get at, but I do think it's so valuable to say overall, what is this access to opportunity? Who has it? Who doesn't? How does that play out with race in place, right? So we'll have to figure out, again, the balancing act on how to do, I think, a little bit of both, because they are both very helpful.
Yeah, for sure. I think it's more of an ecological type of study that we look
Yeah.
at with that, but still helpful.
Absolutely.
If I could add one more thing to your answer, Teresa, just so everyone knows, the 2015 Opportunity Index still does exist. If you go to the opportunity.org website, over to the About tab, if you click About, you'll see that there's a link at the bottom to the 2015 index. And while it's not measuring the same things, because as Teresa mentioned, they kind of evolved what kind of indicators we were using, you can look at them side by side. And just as we add new indicators in the future, it might not be a direct comparison to the new 2021, but you'll still be able to generally see, however we categorize them that year, how does that compare to how we're categorizing census tract this year? So there is some ability to see some change over time. But because there was so much kind of evolution from the first one to the second one, it might not be a one-to-one comparison. But I think after another 5 years of conversations, we got to like a pretty good point with indicators. And I'm not going to say it won't change the next time we do it, but it'll be more consistent and maybe more applicable to kind of take that like, well, what was very high access to opportunity 2 years ago to compare to the map now. So in a way, you'll be able to look side by side. Just wanted to make sure people know that the 2015 one still does exist, and just like this one will exist when we update it. So.
And for those of you who are already thinking about how you want to apply it in your work, so we're going to be adding a form, hopefully, if not this week, early next, on our website where you can request the data. It's going to be available. We only want to sort of stay in touch with people who use it. Mostly so we can hear how you have applied it and if it's a great example that we could be sharing with others. So look for that. You'll be able to get the data as shape files or else as spreadsheets. So that will be added, I'm going to say early next week to be safe. And Natalie's shaking her head or agreeing with me, so I feel like that's a fair thing to say. So if you are interested in incorporating it into your work, let us know next week.
Any other questions at this point? Feel free to raise your hand, or since not everyone's jumping out on at once, you can unmute yourself and just ask the question.
So I had a question for actually something that Emily presented in her slides. And I was wondering toward the end, Emily, you were talking about the number of opportunity or low opportunity areas that you would be focusing on, and it was significantly lower than in the previous index. Does that mean that there's fewer? That doesn't mean that there's fewer low opportunity areas. What was that about?
The areas that have an overall score of low and very low do have a smaller coverage area on the updated map, which we think more accurately reflects the areas that should be targeted. So that'll really help hone in on where those investments should be going.
Okay, I see it now that it's actually square miles, so that's different. Okay,
yes,
thanks.
And that was a change. The last index, we have the ranges from high to low were done in quintiles, so it was really even splits. And this index, it's natural breaks, so it's more of a curve, if you will. And so we have fewer very low opportunity areas overall. And that was related to a little bit of a change and help from Poverty Solutions and how we think about it and present it. So there was definitely a shift between the two, how we basically crunch the data on the index side.
Last chance to unmute yourself and ask a question. Teresa did put in the chat her contact information if you do have questions or And I will say that we are recording this event and we'll post it probably on the Opportunity Index website, opportunitywashington.org, on the About page, just so you can go back and look at it again if you joined late or want access to the slides.
I just think it's fabulous. There's 60 people still here. I can't thank you enough for being part of it. I'll hand it back to Sue maybe to close us out.
Thank you, Teresa. Thank you, everybody today for coming. Thank you, presenters, for presenting. Thank you for all the people, and this is not in order of importance, this work. And I thank everybody for participating. We have an equity gap in our county. The Board of Commissioners is working hard to close it. It's a big, big job, and we need all hands on deck, as people like to say. And so this tool is a helpful tool to help us know more of what needs to be done and where it needs to be done. And so I'm just so excited about it and all the work that we're going to be able to do with it. So thank you.
Have a great afternoon, everybody.
Thank you, you too.